Alright. So welcome to therapy. I'm gonna be your therapist for today. My name is Marla Gonzalez. I'm an MFT trainee and I currently attend CPU and I'm in my master's program. So that basically means that I'm still skilled learning to get my license. And I currently work under the license of Lennon Sullivan, which is my supervisor. And that basically means that we just like go over treatment goals and notes together, just so that we provide effective treatment for you. And for right now, I'm just gonna quickly put a timer just so we respect the time we have together.
Okay.
Just because I know that you're busy,
Mhm.
so I don't want to hold you for longer than you have to be here. But today, because it is a first assessment, I'll just kind of go over the informed consent with you for a little bit. I know that we previously sent it to you, but we'll just kind of touch on it a little bit. We'll do a holistic assessment, and that will basically take the majority of our time.
Okay.
So I apologize if it's a little boring today.
It's okay.
All right. So basically, for the informed consent, the informed consent goes over like confidentiality, and basically everything that we talk about here is confidential. So I won't share with anybody except my supervisor because we do go over those notes together. And if you ever choose to talk to anybody about anything, that's also up to you.
Okay.
Other than that, everything's pretty much confidential and will stay in here. And yeah, so then we'll kind of continue on it. But if you ever have like any questions or anything, feel free to ask.
Okay. Perfect.
Okay.
Are there like any ways that you would break, like that you would have to tell anyone, or?
Yeah. So if there's ever like reasonable suspicion of an abuse of like a minor, elderly, or dependent adult, if a court issues a court order requesting like your personal information, and if you ever express like suicidal ideation or like intent to a minor or other independent adult, then we would have to like break the confidentiality.
Okay.
But other than that, everything's pretty much safe between you and me.
Okay, that sounds good.
All right, so we'll go ahead and continue on. And just so you know, like as you have consented already previously before the session to the therapy, we'll kind of continue on today with our assessment. So it's going to be a lot of questions, honestly.
Okay.
And I do apologize if it is a little boring.
Okay, it's okay.
Okay, so just to kind of get us started, I've kind of explained a little bit about me, but right now we'll kind of focus on you. So what would be your name?
My name's Leah.
Okay, and can you spell that out for me?
Leah. And my last name is Apple.
Okay. And what is your date of birth?
It's gonna be October 12th.
Okay, October 12th.
2001.
And what is your preferred gender?
Female.
Okay, female. And can I ask what your marital status is?
I'm single.
Okay, single. And can I ask real quick, how many children do you have, or if you have any children?
I don't have any children.
Okay. So the rest is just gonna pretty much be like this.
Okay.
It's gonna be a lot of questions.
Okay.
And if there's ever anything you're uncomfortable with, you don't have to answer, so don't feel pressured.
Okay, thank you.
Of course. So when it comes to like occupational or like employment status, like what would you kind of say for that?
Well, I don't have a job right now. I recently got fired from my job.
Okay. And can I ask you a little bit about why?
Well, I had like this big like marketing job. It honestly was like my dream job, but my company like downsized by a lot, so they let a lot of people go, and like I recently got the job, and I'm one of the younger workers and one of the newer workers, so they let me go first.
Okay. And can I ask a little bit? We're gonna go kind of like jump back and forth a bit, but when it comes to like ethnicity wise, like what would you kind of say is your ethnicity?
I'm Asian American.
Asian American. Okay. And what is your current living situation, or like who lives with you?
Well, I recently had to move back into my parents' house because of the job loss. I was living on my own for about like, it was almost gonna hit a year. Luckily, I was able to break my lease because it was a month-to-month lease, but I just wasn't able to afford it anymore. Like with other bills that I had, I just figured like my best financial decision would be like moving back in with my parents.
Okay, so primarily parents then?
Yeah, currently yes.
Currently, okay. And then when it comes to like educational areas, like would you consider being in education full-time, part-time, or not at all?
Currently I'm not in education anymore because I already graduated. I have my bachelor's, and that's what I landed my job with. I'm considering going back to get a master's now just because I did lose my job, and I think, it'd be easier to find a job with a little bit more education under my belt. But no, currently I've just really been on like the job hunt.
Okay. But congratulations on the bachelor's, because even that is not easy.
Yeah, it definitely was rough.
Yeah, it definitely can be. And I know that you've kind of expressed a couple of concerns, like with the downsizing that you've had with your job. So would that be kind of the reason why you're seeking therapy at this time, or is there another reason?
Yeah, I just feel like I've just been having like a rough time, like getting used to like this new normal. It was really nice, like, getting my job, moving out, and it just felt like it was the start of something new, and kind of all just came like crashing down once I lost my job. And I guess I just didn't realize like how different my life would be and how dependent my life was on, that job that I had. But yeah,
Mm-hmm.
I guess I would say a lot of what I've been going through probably has to do with the job loss.
Okay, and I know that you said like getting used to the new normal.
Mm-hmm.
So now that's like a little bit different than how it used to be. When it comes to like any symptoms, like do you present with any like physical symptoms due to the situation?
Nothing physical. I would say like I definitely feel like maybe I sometimes get like headaches. I don't know if it's because I'm like stressing out, about how or basically what to do with my life. But yeah, sometimes I get like headaches or feel like fatigue. And I don't know I'm tired because I'm not working or I'm not going anywhere or doing anything. But yeah, definitely like feeling more down and just like confused and worried a lot.
Okay, and then those feelings are all understandable because you are going through a lot.
Yeah.
So I do get why you might be having like this big stressor
Yeah.
and all these like stressor like effects basically.
Mm-hmm.
So I do get that. But kind of thinking on like the headaches, the fatigue, and like just kind of feeling down, like how frequent would you kind of say that they occur for you?
Honestly, every day I feel like either the fatigueness or the headaches. More often the fatigueness, but as for like the sadness and like the just feeling down and worried, that's definitely every day. Maybe I guess yeah. Now I think about it, the headaches and stuff, maybe more like a few times a week, but like the more mental things, definitely every day.
Okay. And then like when it comes to duration wise, like how long would you say that they kind of occur? Like in minutes, days, hours?
Well, most of my day I feel like pretty down, or like worried, or just kind of like what do I do in my life? But I would say for the most part, like there's some times where like I'm watching a show or I'm hanging with my family and friends and I can like forget about what's going on, but it's mainly only if I'm like distracted. Anytime that I'm like alone, I usually feel those feelings.
Okay. And then like on a scale of like 1 to 10, how intense would you say that they are?
Um, on an average day, I would say like a 7.
So pretty high.
Yeah.
Okay. And then where would you like that 7 to be?
In what context?
Of like let's say we kind of go through a variety of sessions together, like maybe 12. And if you think about like if this is our last session, where would you like all these symptoms to kind of be?
I feel like in general I am a pretty like I get pretty anxious and stuff, so I'm not expecting to get to like a 1 or anything, but it would be nice to at least get to like a 4, where there's just certain parts of my days or little things that trigger me. But yeah, I think a 4 would be nice.
Okay. And then can you possibly like I know that you've been kind of dealing with this for a while, but do you maybe remember like when the symptoms all started?
Yeah, after I lost my job, I lost it about like 6 months ago, so maybe 6, 7 months now.
Right, so it's been quite a minute.
Yeah.
Okay. And then how do you think that these symptoms are currently like impacting your day-to-day functioning?
Yeah, I definitely think it's been impacting my everyday. Sometimes I just don't want to even get out of bed.
And that's understandable because once again it is very hard.
Mm-hmm.
But I do appreciate you being able to share this with me because I know that this is a tough situation to go through for sure. So now kind of continuing on with like our assessment, we'll kind of go a little bit more into like history and like other issues as well.
Mm-hmm.
But once again, if there's ever anything you don't want to talk about, we'll kind of not go too in depth today.
Mm-hmm.
But in our next sessions, we'll go more in detail basically.
Okay.
So when it comes to like history of your presenting problem, have you ever had like previous psychological treatment, like or previous therapy?
I used to go to therapy like when I was younger. I'm 24 now, but I attended therapy in high school for a little while. I had like anxiety basically, as I explained to you. I've always kind of struggled with anxiety. It helped me a lot. I feel like it was nice to like get that validation and just be able to like express how I felt. But I stopped going. Life got busy. I was in college, and I just didn't fit in the time to go to therapy again. And that's kind of why I came back now, because I know it's worked for me in the past. So I feel like it can definitely help me now.
Okay. And then did you like fully choose it on your own or did anybody like recommend you to come?
I was getting a lot of like panic attacks. So
Okay.
I kind of like mentioned it to my doctor. It kind of got to a point where I was a little worried. So I mentioned it to my doctor and he referred me to psychotherapy.
Okay. Well, I'm glad that you're here now.
Thank you.
We'll like work it together for sure. Have you ever just kind of getting more into like the history of the presenting problem? But do you take like any medications related to any of your symptoms or anything like that?
No, I don't take medicine. I That's kind of one of the reasons why I did psychotherapy as well. I didn't want to go like the medication route. So
Yeah. Okay. And I know that you kind of said that you were having like a little bit of panic attacks,
mm-hmm.
but have you ever been like hospitalized before due to the situation?
No.
No? Okay. And then when it comes to like other kind of issues, I guess, would you say that like you've ever had difficulties or like anything that really came up from like your past experiences with therapy?
No, I don't think so.
Okay. And do you take any like substances, like drugs or alcohol?
I do drink, not much, but recently I have definitely feel like I have been a little more because it just helps me to like forget really about what's going on. So I feel like on average I'm drinking like 3 drinks a day, maybe. Before it was more like a social thing whenever I went out with friends, but yeah.
Okay, so a little bit more recent increase in flavors.
Yeah.
Okay. Definitely drinking is something that does tend to like kind of keep us out of that mindset for sure.
Yeah.
So I do understand that. And then when it comes to like any like suicidal attempts or ideation, has that ever been a thing with you? Or has that ever come up for you?
No.
Okay, so no attempts, but maybe like ideation?
No. No.
Okay. And if there ever is something that tends to come up with you, feel free to talk to me about it.
Okay.
This is a safe space, so anything you want to talk about is totally fine.
Okay. Thank you. I appreciate it.
Of course. And kind of getting down to like any homicidal like attempts or ideation, has that ever also been a thing with you?
No.
Okay. And once again, if you have any questions, feel free to ask.
Okay.
Because
Thank
I
you.
know sometimes there's a lot of terms.
Yeah.
That might be a lot hard.
Yes. Thank you.
Okay. So when it comes to like more family history, I know we kind of talked a little bit about the family, but has like your family ever had like any history of like being sent to therapy or any treatment like that, or any diagnosis maybe?
No. Well, I have like my dad. He has like a little bit of depression symptoms. There was like a point, and he is was a past alcoholic, but he's a recovered alcoholic. He doesn't drink anymore. And I feel like his depression has gotten a lot better since he did cut drinking out. But other than that, no, nothing for my mom.
Okay. Yeah, I'm just kind of checking because sometimes maybe the family has something and we don't know and it kind of like shows up. So we just tend to ask a bit.
Okay.
But when it comes to like more of like the family, how would you kind of describe like your family dynamics?
I'm definitely very close to my parents. Both of my parents, to be honest with you. Me and my dad, when he was like more heavily using alcohol and stuff, we were a little distant, but we definitely have like mended our relationship. And I think now that I've moved back in, like I, leaned on my parents a lot, so we're definitely pretty close. And I don't have any siblings. I'm the only child.
Okay. So pretty close, and every once in a while, like there's a little bit of distance.
Mm-hmm.
But even currently now, you have described that you've been pretty close with your parents.
Yeah.
Which is a pretty good thing, just to have like that support as you are currently going through a situation as well.
Yeah, that's been really nice.
And just kind of getting more down into like a little bit more maybe intense or more triggering.
Mm-hmm.
But if there ever is anything that I say that's triggering, feel free to tell me.
Okay. Thank you.
Of course. But just kind of like getting down to that. Have you ever like noted any maybe domestic violence or abuse?
No.
No? Okay. And has your family ever like, I know that you kind of described your father was like a past alcoholic, kind of dealing with that still. But like, is there ever any like other substance or even like medical situations in the family?
No.
No? Okay. So then when it comes down to like more of developmental history, like when would you say that like milestones, maybe like walking, talking, and like all of that are developed? In your own opinion?
I feel like I think everything was pretty average from like what my parents told me or what my mom has told me. Like I walked at a normal time, talked. Like I never really had like any developmental like back. I was never backed up on anything developmentally.
Okay, that's pretty good.
Yeah,
that's pretty good. Yeah. Okay, so on time basically.
Yes.
Okay. And have you ever like had any developmental like issues even now, or everything's still pretty good?
Yeah, everything's good.
Okay. And when it comes to like any strengths or areas that you maybe have like trouble in, is there anything like that, or is it still pretty good?
No, pretty good.
Okay. So as we kind of continue, we're just gonna go more into like more of the work stuff. So I know that work is pretty much one of the biggest difficulties that you're having right now, like due to downsizing. But can I ask, like, what is your highest level of like education that you've completed?
Yeah, my bachelor's.
The bachelor's. Okay. I know that you did kind of state it earlier, but I just wanted to kind of double check.
Yeah.
Yeah.
Of course.
Because we don't always remember everything.
Yeah. No. That makes sense.
Okay. And then what would you say are like some of your academic like strengths or even just weaknesses?
I would say I'm really good at like math, science, I have a little bit more issues with like English, reading, but definitely more like a STEM girl.
Okay.
Yeah.
Okay, that's really good though. And I know that earlier you kind of said that not really learning issues or anything, so you're pretty good there. But when it comes to like work history, the current job that you were like fired from, is that like the main job that you've been in, or was there like previous jobs that you had before?
That's like my main like serious career job I've had. Before I worked in my college, like when I was in undergrad, like I worked in like peer group studying or like I worked for like on campus with like the ASI, but never any serious job other than that.
Okay. And did you ever have like any other work related difficulties except the one that you're currently in right now?
No, because they were all like unserious jobs, so I would just
Okay.
swap from job to job. It was just never really a big deal.
Okay, no, that's totally understandable. And when it comes to like social support, I know that you've said that your parents are really big support, but do you have like any other people that you would consider to be in your support?
I do have two best friends. I only have one that lives near me because my other friends they live like more where we went to undergrad for school. Most of my friends still live out there. I went to undergrad like in LA, so most like of everyone that I'm close to lives out there, and they have their big girl jobs out there.
Okay.
But for me, only one of my friends lives near me, and that's just because she works from home. But yeah, she also still has like a really good job still.
Okay. And then I know that so you do have these support system. Is there anybody maybe like from the job that you're kind of downsides from that you would consider to be part of your support system?
No,
No.
I don't really talk to them
That's totally understandable. I get that.
anymore.
So, okay, so just kind of to continue, I know that we kind of went over medical history a little bit, and we kind of talked about like culture and like the family and stuff.
Yeah.
But would you like what would you consider to be like your primary religion, or do you kind of not have religion at this time?
I'm not really religious. My family is Christian, but I don't like really attend church or anything. I only go like on Easter or like
Okay,
or Christmas, but I wouldn't consider myself like super religious. And my family, like they go to church every so often, but yeah, I only go on the major holidays.
okay, and that's totally understandable. And then when it comes just real quick, I know it's a little big shift,
Hmm.
but have you ever experienced like any legal issues, like court cases, DUIs, even tickets?
No.
No. Okay. And then just as we're kind of coming to an end, because I know I want to respect your time.
Hmm.
So as we're kind of coming to an end, we're just gonna go over like client goals basically. So thinking of like a couple goals, because I know you're here for a reason.
Yeah.
So our overall goal, I guess, for therapy is to kind of figure out like what you want to get from therapy and kind of like so that you could be ready for when you leave therapy.
Hmm.
Okay, so what would you kind of consider to be the main reason that you're here for therapy?
I would say to just feel better with my new normal. Be more comfortable with how my life is now, and also bring my mood up so I can like look for jobs easier or figure out what my next step is going to be in life.
Okay. And I know earlier when we talked about symptoms, because currently your symptoms you did say are 7.
Hmm.
Another goal that you did discuss earlier was that you would want them to be like a 4 or even possibly lower.
Yeah.
But we could for sure work on that as well.
Hmm.
So that could also be a goal. But what would you kind of like want for me to kind of help you out?
Honestly, I'm not really sure. I guess like helping me find out what I can do. I don't know. I don't
Okay.
know. Just really confused right now.
Not necessarily
Yeah.
understandable, but is there anything that you would like not want from me then?
No. Like I feel like I'm whatever like you're willing to try or what you want, I'm willing to try.
Okay. So hopefully our next sessions will be a little more interesting.
Yeah.
But just kind of as like we're getting the goals and stuff, just like one more quick question.
Hmm.
But because I know treatment is a very slow process.
Yeah.
So at first we might not notice the changes.
Yeah.
Eventually we will. But just kind of thinking on like let's say this is our last session and we're kind of like done or kind of getting to the point where we're being done with therapy. Like how do you think you would feel differently than you do now?
Definitely a better mood, and I would feel like more confident
Okay.
and just feel more comfortable in my own life.
Okay. And so thank you for sharing like all of this because I know it is a very touchy subject, like being in the job that you're kind of downsized from, and that you're experiencing all these different symptoms that are like affecting your mood and all of that. So as we'll kind of continue on in our sessions, we'll work on that treatment plan with you. We'll like re-go over the goals, and if there's ever anything that like you don't agree with, always feel free to tell me. We can always change it up
Okay.
depending on how you want it. But yeah, that's pretty much it for today's session. I do apologize once again. It was a lot of questioning, pretty boring. But our next sessions hopefully will be a little bit more fun, uplifting. Hopefully.
Okay. Yeah, that sounds good. Thank you so much.
Of course. And then just okay. And then how committed would you say that you are to therapy?
I'm pretty committed. I have nothing going on in my life, so I can come whenever.
Okay, for sure. So then we'll go ahead and schedule your next appointment, and then we'll see you next week.
Okay, perfect. Thank you so much.
Of course. Have a wonderful day.
Thank you. You too.